This is a contrast CT scan of a 57 years old female patient. Patient is a known case of hepatocellular carcinoma with intrahepatic metastasis. Now the patient has presented with acute abdominal pain. There is moderate pleural effusion on right side, but there is mild pleural effusion on left side. There is massive ascites. This is the hepatocellular carcinoma. Multiple intrahepatic metastases are present. Portal vein and its intrahepatic biliary channels are patent. This is a small calculus in the region of neck of gallbladder. This is a lymphoid mass here, metastatic, lying posterior to the head of pancreas. This is the portal vein here. As I scroll it down, these are the enlarged metastatic lymph nodes in interaortocaval region, para-aortic region, these one here. Now please see that this is a lymphoid mass in the root of mesentery. Malignant looking, typical features of a metastatic mass. Now please follow the superior mesenteric artery. This is superior mesenteric artery, this one here. This is the superior mesenteric artery. The lumens of superior mesenteric artery and superior mesenteric vein are surrounded by the mass. Their lumens are occluded. These are not traceable lower down. Oral contrast medium has been given ideally in such cases where ischemia is suspected. A negative contrast should be given so that the total wall thickness and extent of edema and enhancement can be assessed. In this particular case, the orally administered contrast medium is passing normally through the small intestine and entering the cecum and ascending colon. The advantages of the positive oral contrast medium are that we can assess the amount of peristalsis. Although dilated gut segments are present because of the gut ischemia, but the contrast medium is passing through the small intestine, so this excludes the intestinal obstruction. Please see these dilated gut segments. There is thickening of the jejunal segments here, showing non-homogeneous enhancement. Please observe these thickened and edematous valvulae conniventis, wall thickening, dilated lumens, massive ascites, uterus and ovaries are normal. The contrast medium has entered the cecum and ascending colon. Typical features of ischemia are also present, involving cecum, gut wall thickening, please see this thickened gut wall. This is equivalent to the thumb printing that we come across, or we are used to looking at the barium studies. This is the ascending colon. Similar features of the mucosal edema, gut wall thickening. This is the right half of transverse colon. So the ischemia has not only involved the jejunum, ileum, but also the cecum and ascending colon and the right half of transverse colon. Typically in the distribution of the superior mesenteric artery, the occlusion of superior mesenteric vein also contributes to the findings. Now the severity of the ischemia also depicts the extent of the gut findings. There may be pneumatosis intestinalis, pneumatosis portalis, gut wall ischemia and perforation, pneumoperitoneum, etc. None of these findings is present in this particular case. This is the coronal scan. Please see these dilated small gut segments. Although there is dilatation of the gut, but there is no obstruction. This is the advantage of the orally administered contrast medium, that it excludes the intestinal obstruction, number one, and number two, any perforation. If there was any perforation of intestine, the contrast medium would have leaked out of the lumen of the intestine. Now this is the lymphoid mass here, this one. This has occluded the lumens of superior mesenteric artery and superior mesenteric vein, resulting in the typical features of small and large intestinal ischemia. Please observe thickened wall showing non-homogeneous enhancement. The enhancement patterns vary with the degree of ischemia, whether it is acute or gradual onset, and the development of collaterals. Now this is the cecum here. Please see the wall thickening, mucosal enhancement, typical features of the colonic ischemia, semicolon. This is the right half of transverse colon. This is the sagittal scan. Now, such findings like this one here, mucosal edema, these are equivalent to the thumb printing that we are used to looking at the contrast studies of the intestine, like barium, enema, and barium meal examinations. Irregularly thickened wall, marked mucosal edema. This is the right half of transverse colon.